So this is a phase 1 study that was performed in patients undergoing a standard of care autologous stem cell transplant with a standard of care melphalan conditioning regimen. And the PNK-007 cells are placental derived natural killer cells. So they're an off-the-shelf therapy, allogeneic NK-cell therapy. And the idea with this phase 1 study was to integrate them into the immediate post-melphalan transplant period. The primary thing that we were looking at was the safety of this approach. There were several different patient cohorts that were treated. So some patients received an infusion of these natural killer cells at day 14 after their stem cell transplant. Another cohort received them at day 7 post-stem cell transplant. And then there was another cohort that received them without IL-2. The first several cohorts did receive IL-2 after receiving the NK cells. What we were able to determine from this phase 1 study was that there were no toxicities associated with the NK cell infusions. There were no problems with eventual engraftment. And we did do MRD testing at day 90. It's a little too early to know anything about the efficacy of this approach. And the next step will be to do a randomized study integrating these NK cells after stem cell transplant. But I think this is a really exciting study because it is a brand new product that represents off-the-shelf NK cell therapy. The next step will be to use a slightly different product. The pink cells were essentially shipped fresh. The next step will be to use a product that has been cryopreserved, and a randomized study is going to be performed in which patients are randomized to just a standard of care stem cell transplant versus receiving 3 infusions of these cryopreserved natural killer cells at various time points after their stem cell transplant. And we'll be looking at efficacy and looking at MRD negativity rates post-transplant.